Well, we know October is Breast Cancer Awareness Month, and we typically think of women, but we're going to talk about men. And joining us today, he is a surgeon with Lima Memorial Health System's surgical specialist, Dr. Jeremy Heffner. And thanks for joining us, Doctor.
Morning.
All right, so tell us more, because men do get breast cancer, right?
Correct, yes, men can get breast cancer. And I think that it gets lost in the whole scheme of Breast Cancer Awareness Month that, 5%, a little less than 5% of breast cancer cases are going to be men. It's a specific type that men tend to get. But, I think that since the systems are designed preferentially to treat women, since that's the vast majority of breast cancer patients, the men kind of get lost in the shuffle. And it can be very disorienting for them and difficult for them to kind of, one, understand the position they're in once they get diagnosed with it, and two, find a place in the system that makes sense for them as they work their way through the treatment program. So it is quite difficult, I think, for men, and they kind of get left out of it.
Yeah, so let's try to include them. So if you're a man, what symptoms do you look for?
Anytime we're dealing with cancers, first, masses. If you feel a mass in your breast, the vast majority of time in men, it's going to be a benign issue, even as we get older. But there are going to be some, as I said, a rare few that it's actually going to be a cancer. So if you feel a new mass in your breast, then it is something to consider, and you would actually have to undergo a mammogram and an ultrasound, just like a woman would. But other than that, you're looking at things like weight loss without any reason for it. So you're not attempting to lose weight, but you're losing weight. New headaches, I would say, fevers, chills, night sweats. These are all signs of an underlying pathology or something that's going wrong that we need to take a look at more closely. So any of those things would be kind of red flags. But really, if you feel something in the breast and it's new, you need to have somebody look at it, a doctor, professional of some sort.
And you touched on this, so men can have a mammogram and get that looked at that way?
Absolutely, yeah. I think that it's a little more difficult for some men because the size of the breast, it's kind of difficult to get the compression you need. However, we do them, and you can get them as a man. But the ultrasound's the other modality. And then we also, of course, in the modern day, have MRIs if we needed to take another look at it. Most of the time when there's a mass of unknown origin and there's any question on the imaging, then we're looking at a biopsy to determine what it is.
So do men have breast surgery like women do? Or do you treat it differently when you find it in men?
No, it's treated the same. The difficulty with men is they don't have as much tissue in that area, so it has a tendency to invade the structures around it more quickly. So men have a worse outcome, and the sooner we can diagnose it, the quicker we can get it out, the better it is for men. It's generally speaking, it's going to be the better, but because there's not as much breast tissue in there for it to grow into before it gets into skin, muscle, or deeper structures, we really want to get that out and try to preserve those planes and prevent it from invading other things around it, making it a higher stage.
Does this run in the family? How do men even think, well, how do I even know if maybe I should be checking this out?
Anytime we talk about breast cancer, the vast majority of them are what we call de novo or new. So in men, it's the same thing. If you have a family history of breast cancer, and it's not just breast cancer, it's other cancers kind of in that family. We always talk about gastric cancers, colon cancer, prostate cancer. In women, it would be gynecological cancer, so your uterine cancer, your ovarian cancers. We want to look at all of those from a family history standpoint and kind of look at your risk factors. If you have a family history of breast cancer, then yes, men also have a potential carrying that gene. But the genetic or the familial cancers in the form of breast is only about 5% of them. So most breast cancers, even in men, there's still going to be something that just arises because you just happen to develop breast cancer.
Okay, well, Dr. Heffner, thank you very much for joining us today, raising awareness that men can get breast cancer too during this Breast Cancer Awareness Month.
Yep, and we're here to take care of you if you need any help.
All right, well, thank you for joining us. All right, don't go away. We'll be right back after this.